Hi guys, this is Jim the Life Coach. You're going to do a bonus episode today, and we're going to talk about this coronavirus or COVID-19, as it's been dubbed, or is its actual technical name even? Yeah. So we're going to read a couple articles. I've got a few here that I wanted to read and just talk about them and what they mean and so forth. So there's two ways that we're going to try and battle this disease in the UK. One of them is herd immunity, and one of them is self-isolation, where we just isolate ourselves off away and we don't really interact with anybody until such time that it's deemed us to be, healthy enough to go out as a community. But they're saying it's going to go on for like a year and such. People are already looking at next year as a time where it will calm down. So despite some people's view that it's a harsh flu, or a harsh strain of the flu, where if you have respiratory problems, then or your immune system is low, or you're old age, then you've got underlying health problems, then this thing will take you down. But so you've got to just protect yourself, wash your hands, and generally wash your hands properly. Don't touch too many surfaces that are disgusting, and wash your hands after you touch them. And generally just be clean. So we're going to look at herd immunity. Okay, it's a technique that the government is trying to enforce, basically. Yeah. So they want to try this thing here. So let me find this thing. Hold on one sec. Here we go. So let's go to Telegraph. Okay. So this is an article from about 2 days ago. It's from the UK's chief scientific advisor. He says that 2/3 of Britain's population would need to get coronavirus to stave off the disease in the future. All right, so the UK's chief scientific officer has said a degree of herd immunity will help the UK population as COVID-19 spreads. So Patrick Vallance acknowledged that there are fears that clamping down too hard on the spread of the virus through tight social distancing measures could see it return in the future. He said the aim is to reduce the peak, broaden the peak, not suppress it. So reduce the peak, broaden the peak, not suppress it completely. Also, because the vast majority of people get a mild illness, to build up some kind of herd immunity, so more people are immune to this disease, and we reduce the transmission. Let me say that again. He said the aim is to reduce the peak, broaden the peak, not suppress it completely. Also, because the vast majority of people get mild illness, to build up some kind of herd immunity, so more people are immune to this disease, and we reduce the transmission. Okay. In Sir Patrick's opinion, almost 2/3 of Britain's population would need to contract the coronavirus in order to herd immunity to stave off the disease in the future. That's his view. Okay. Now, I don't know what you think of that, but that sounds kind of scary to me, because it seems like a luck thing. You have to hope that the virus that is here now is the one that's it's going to obviously mutate and change to whatever, and we've got to make sure we've got vaccines that can fight this thing anyway. All right, so we're going to read something from the Mirror. Hopefully I can get in this. Hold on one sec. Hope it goes all right. Okay, so let me read it. Maybe not. I'll just accept that. All right, cool. All right, so herd immunity is a phrase that is likely to be discussed more widely in the coming days and weeks. It's one of the ways the government is planning to reduce the impact of coronavirus, which has so far killed 10 people in the UK and infected 590. Prime Minister Boris Johnson announced on Thursday that his government has decided to escalate the UK's response to crisis from contain to delay. The delay phase involves potential closure of schools and postponing or even cancelling large events. Which some of them have already been done anyway. But it's also expected that during this period, we'll hear the term herd immunity on a more regular basis. So what does it mean? Herd immunity is when a large number of people have become immune to an infection. This is achieved by our bodies developing enough antibodies to fight a disease. It's basically the simplest version of it, yeah? If the number of immune people dominates the population, then it reduces the chances of an epidemic, as those who catch the disease will be surrounded by people who can't be infected. I'll read that again. If the number of immune people dominates the population, then it reduces the chances of epidemic, as those who catch the disease will be surrounded by people who can't be infected. People can become immune to a disease through vaccination or by recovery. At present, there's no vaccine for COVID-19, so recovery is the only option available. What's the government's plan? It's been suggested that another aim for the government strategy is to allow the majority of the country to catch the virus at some point at a slower rate. The decreased speed would allow those who are most at risk, such as elderly people and those with underlying health conditions, and therefore need the most treatment to get that, without putting too much strain on the NHS. UK's Chief Medical Officer and Chief Scientific Officer have both judged the newly categorised pandemic will spread around the world, making it a constant threat until a vaccine becomes widely available. All right, so they reckon it's going to go around the world and then some. Okay, so this is like a thing that's not going to go away. But there's been people who've been panic buying. They've been buying. I went to the shop today and there was no toilet paper. There was no bread. There was no beans. I managed to get two little small tin of beans. There was no Sainsbury's water. Yeah. And maybe a few bucks. Then there's surprisingly enough the big Sainsbury's waters. I didn't bother buy those ones, so I bought one myself. So that was weird. Yeah, there was lots of things that with shelves missing. There was liquor gone. People want to get drunk in the time that they're sick or they're going to be in the house. So there was enough liquor gone. And lots of cereal gone. Cereal depleted. But loads of fruit juice. Stuff that you're going to need to kind of fight this kind of thing. The natural juices that will help you get the good vitamins that you need to fight off these viruses and stuff like that. It's crazy, man. So let's read one more article. Here we go. Let's try this one. The problem with using herd immunity to fight coronavirus. That sounds quite good. All right. The UK's Nudge Unit, Dominic Cummings, are weighing up herd immunity as a possible endgame for coronavirus, but the consequences could be severe. Okay. The problem with using herd immunity to fight coronavirus. Let's try this. In the UK, the number of confirmed coronavirus cases keeps on steadily ticking upwards. As of March 12th, just a couple of days ago, it had 590 confirmed infections and 134 case increase on the previous day. Up until now, the government strategy has been simple. First, try and contain the outbreak and then delay the spread, evening out the pressure on the NHS. But now people involved in the government's coronavirus response appear to be mooting a new strategy, herd immunity. On March the 11th, David Hapern, Chief Executive of the government-owned Behavioural Right Insights team and a member of the Scientific Advisory Group for Emergencies, outlining an approach that depended on shielding vulnerable people until enough of the UK population had been infected with the COVID-19, that acquired immunity stopped its spread altogether. On ITV website, Robert Petson referred to the same idea, writing that the strategy of the British government is to allow the virus to pass through the entire population so that we acquire herd immunity. So how does the concept work? People can gain immunity to disease after being exposed to them, and once enough people are immune to the disease, either through exposure or vaccines, it will stop circulating within the population. That's herd immunity. This policy would put the UK government in a distinct contrast from China and South Korea, who responded to their own outbreaks by several restricting travel and monitoring events, managing to limit the extent of their current outbreaks. Italy, too, is trying similar policies, including banning most public gatherings, although it's still too early to know whether that has stopped the spread of the disease there. We contacted the Department of Health and Social Care to clarify if herd immunity was part of the government's official coronavirus strategy, but it did not respond in time for publication. But how would herd immunity work in the UK if it is adopted? Roughly speaking, given what we know about the current infection rate of COVID-19, the disease would need to infect approximately half of the population until we achieved herd immunity. Although over 80% of COVID-19 infections are mild, that add up to more than 6 million people at risk of severe symptoms. Can you imagine that? Severe. And according to a Chinese study of 44,415 confirmed cases, around 5% of people experience critical illness, including respiratory failure, septic shock, or organ failure. All right, 5%. The problem is that the embracing herd immunity could well put the NHS under immense strain, depending on how well we were able to shield vulnerable people from the disease. Jeremy Rossman, a virologist at the University of Kent, isn't convinced that accepting herd immunity is inevitable. I think it's more likely that with continued containment and delay strategies, we will be able to stop the virus spread well before reaching even 50%, he says. Even spread over a period of months, widespread infection is obviously not an acceptable plan, nor is this a necessary or inevitable outcome, especially with good surveillance, containment, delay, and social distancing measures enacted. The example of other countries suggests that herd immunity might not be the only ending point of the coronavirus outbreak. In South Korea, which recorded 851 new cases in a single day at its peak, the outbreak is slowing. Yesterday, it recorded a total of 242 new cases after some of the most widespread testing in the world. China, once the center of the global outbreak, recorded only 31 new cases in the WHO's latest situation reports. Although it's difficult to know the precise number of people who have caught the infection in China, it does suggest it's possible to contain the current outbreak without half the population catching the disease. It is possible that China or South Korea will experience subsequent outbreaks, so we still don't know how effective mass quarantine is in the long run. But while other countries, including Denmark, Spain, and the Republic of Ireland, are doubling down on the containment by shutting schools, limiting public gatherings, the UK, or at least some of those close to the government, are leaning in a different direction. Although the UK government is now moving to the delay phase of its COVID-19 plan, it's not clear what role herd immunity will play in this. What we do know is that it has a keen interest of both the Behavioural Insights team, the so-called Nudge Unit, and Boris Johnson's chief advisor, Dominic Cummings, who brought up the topic in a meeting with UK tech leaders on March 11. How influential they prove to be over the coming months may end up determining the result of the UK's growing coronavirus outbreak. Mad, isn't it? It's crazy. This just sounds like a craziness, because I don't know why they don't just tell people to make sure you stock up on your vitamins, because most people can fight the disease. There was something like, I don't know, out of, say, I'll just give a small number. I'm just trying out a number here, right? This is not accurate whatsoever. This is not scientifically fact data. But say out of 10,000 people in China who got the disease, right? About 1,000 of those people died, and the rest of them recovered from catching COVID-19. Yeah. So what's that? Something like what? 5%, 10%? I don't know. Not a great mathematician. You can tell me. So it just shows that if you do things quickly and swiftly enough and give people the right information, you can fight this disease. It doesn't have to be a thing where everybody catches it. You got to hope that people get it in time and all sorts of blah 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 blah. There is another side to it where people are saying that this is all planned and this is all like a thing to shut down, to control people and make sure that we can get people to do what we want them to do. There's lots of arguments in lots of different ways. I watched a video to say that that said that this is all part of a wide sweeping thing to make sure the control of people is on point. But just up to you. You can do your research and find out little bits and pieces. I'm going to be doing a bonus episode on the 5G that's coming out soon as well, because that seems to be another contentious point that some people don't know all the ins and outs of what the 5G frequency can do to you and your body. So we will go through that at some stage. But I just thought it'd be good to kind of go through some of these things that that some people might not understand or might not be ready for, and just look at different ways that we can kind of do this. The most important thing though is to keep yourself safe. If you feel you need to go out with one of those facial masks, then why not? Make sure you wash your hands at every point. Remember, it's great to use the alcoholic hand gel, but after a while, the bacteria on your hand can they have immunity to your hand gel, and the alcohol that's in the hand gel isn't good for your pores in your hand as well. So you have to be careful it seeps into your system. Remember, your skin is alive. Remember that, yeah? So it's good to use the hand gel, great and all that, but make sure, you use other different ways of washing your hands and keeping your hands clean, all right? maybe some gloves or whatever. If you do sneeze or you have some of the symptoms, then try